So a lot of the restrictions under the tougher lockdown regulations relaxed a bit. South Africa level 1. Let's chat a bit about this now. Professor Salim Abdool, Karim, the chairperson of the Ministerial Advisory Committee, joins me now. Prof, always great to have you here on the program. So I guess at this point, of the relaxation of these lockdown levels, the wearing of masks and all those non-pharmaceutical protocols are going to be extra key as we allow more movement and we try to get to a sense of somewhat normalcy.
Yes, good evening, Griselda, and good evening to all the viewers. You said it exactly. When we think about the easing of the restrictions and the changing of the alert levels, that does not mean and does not give us license to stop following the rules and ensuring we maintain all our prevention measures. They remain just as important at each of the levels, because now we are at a low level of transmission. We want to keep it there, and we definitely don't want it spiking up again. So we have to follow those rules.
Prof, how does the relaxation of the lockdown level fare against what is still considered to be a possible threat of a third wave in South Africa? Quite a number of commentators this morning are concerned about whether South Africa is even ready for that.
So when we look at how first and second waves have occurred in many countries, including our own, and there's been about a dozen countries that have already had a third wave. We've analyzed that data. We've tried to understand what is the timing of the different waves, how does it occur, and what we've come to understand that there's quite a big variability around when the different waves occur. But for South Africa, we can expect that our third wave will occur somewhere around 3 months, plus and minus. So that translates to, given that our second wave ended in the middle of February, we're looking at March, April, and May. So that means we can expect a third wave somewhere in June, July. And given that that's when we expect it, it also coincides with our winter months. That's right. When we sit indoors, we lock our windows, and so on. So we're going to have to be extra careful with doing all those things, because that's when we're going to see the third wave in all. Based on what we've seen so far, there is one proviso, and that is that if there is a new variant, then it's completely unpredictable, and we can then expect a much more severe third wave. If there's no new variant, that we're still dealing with the current variant, then our wave might be a smaller one than we've had in the second wave.
Is South Africa ready to deal with that, whether there is a new variant, whether there isn't, or whether we just have to maneuver through those winter periods, which of course are of concern? If you say then, if that third wave does come, possibly around about June, when we start feeling the pinch of winter.
Yeah, I think based on what we've done so far, we've now got the experience of the first wave and a very severe second wave. So we have the elements of what needs to be done. For example, in the hospital setting, how to ensure we have adequate oxygen, how to ensure we have adequate field hospital beds. So all of those, we've now got a lot more experience, and we set for those kinds of things. Where we are still experiencing challenges is in ensuring that we can maintain and keep down those little flames that I talked about, those little sparks that lead to slight jumps in the number of cases, because one of those can spark and lead us into a fully fledged third wave. Yeah. So how we deal with those little outbreaks that occur, they occur in prisons, in shops, and so on. It's very important to keep those suppressed so that we then prolong the period that we have at low transmission. So all in all, yes, I think mostly we are prepared.
Prof, that second batch of vaccines arriving in South Africa at the weekend, do you know when we'll be expecting the next batch, as you know, vaccination of healthcare workers intensifies? I know that Charlotte Maxeke Hospital is starting with the vaccination of its healthcare workers tomorrow. Do we know when we can expect the next?
So the original arrangements were that we would receive about 300,000 doses in the first group and then another 200,000, adding up to about 500,000 doses. They were supposed to be delivered on a fortnightly basis, but I think they are ahead of schedule, and so they might be coming more frequently than that. As it stands, we have now been expanding the number of sites that have been vaccinating, so it's quite likely that the next batches will come before the fortnight is out.
Is South Africa likely to reach the period of starting to vaccinate within the other groups as we head closer to a June period that we were speaking of? Because I think a lot of the concern is there at the moment in terms of the healthcare workers who are already at quite a fast pace being vaccinated. But I think that the general population as well is a great area of concern.
Yeah, I think when we look at the overall strategy, focusing on healthcare workers makes a lot of sense. That's recommended by the World Health Organization and everyone else. So there's no issue there. With regards to our phase 2, even most of those are well in keeping with what is recommended by the World Health Organization. If we vaccinate just the healthcare workers, the elderly, the comorbidities, and those individuals who are essential workers and congregate settings, that constitutes somewhere in the region of around 16, 18 million, perhaps up to about 20 million people. Yeah. If we can vaccinate those people this year, we will make a huge impact on the fourth wave. I mean, the fourth wave will be really a small wave because most of our admissions will now no longer occur because the elderly and those with comorbidities have now been vaccinated. So we've got to be strategic. We've prioritized it in a way that will minimize the impact on mortality and on hospitalization. And I think if we keep to that strategy, I think we're in a good position.
Prof, thank you very much indeed for your time this evening. Professor Salim Abdool, Karim, the chairperson of the Ministerial Advisory Committee, talking to us, of course, about South Africa on level 1 and some of the restrictions, of course, that have now been relaxed as a result of the country moving to that alert level of the lockdown.